Hey everybody, it's Dan with Pain Free You. Today's topic is medical labels. Alright, I've talked about this before, but boy do I keep on seeing the need to repeat it over and over and over again. Medical labels. I'll get to that in a minute. Before I do, take a look at the nice woods behind us. Take a nice couple of breaths to relax. I've got some neighbors next door with a pool. That's why I'm hearing that. Sounds like a party and some people splashing around. Alright, so medical labels. Can't tell you how many people will write to me through Facebook Messenger, through emails, through the contact form on my website, painforyou.com. And they'll kind of tell me their story and tell me what's going on. And then they'll ask me, Dan, can TMS work help end my pain? I have pudendal neuralgia, or I have pelvic floor dysfunction, or I have trigeminal neuralgia, or I have occipital migraines, or I have, a herniated disc at levels this and that. I've got this, I've got that, I've got GERD, I've got all sorts of medical labels. And my first question is, do you have TMS? You're like, oh yeah, I have TMS. Or I have TMS also. Or I think it's TMS, but I have this medical label. And will this TMS work help with that? And it's not that this TMS work will solve a physical problem. It's just that the label that we've been given is likely an incorrect diagnosis. Meaning, and I'm not suggesting that bulging and herniated discs don't exist, but if you're being told that that is the reason for your pain, that is an incorrect assessment by the medical people, because in most cases, those things don't cause pain. And the evidence in that is all of the people with MRIs that are all over the place still get better through the TMS work. Does that mean that the TMS work has solved, these medical label problems like the bulging, herniations, torn rotator cuff, torn meniscus, bulging disc, herniated disc, pelvic floor dysfunction, pudendal neuralgia? Does it mean that the TMS work fixed that? Or was that label given incorrectly? Maybe you've just got pelvic pain caused by TMS. Maybe you've got back pain caused by TMS. Maybe you've got TMS leg pain, TMS headaches, TMS neck pain, right? The medical labels are there for the medical authorities to assign a term in their insurance coding system so that they can say, this is the diagnosis, here's the insurance code, let's pay for this doctor's visit or treatment, right? As it relates to you, once you've determined that your symptoms are TMS, meaning they are mind-body created, they are in the brain and manifest themselves in these symptoms that we feel in our bodies, but TMS is TMS. And once you know it's TMS, please stop using the labels that the doctor gave you. And why is this so darn important? Well, if you're constantly saying, I have sciatica or neuralgia or, all of these medical terms, how easy do you think your brain is going to believe that you're actually safe? If you think you've got a neuralgia problem in your pelvis or your pelvic area, wow, your brain's going to go, wow, that's dangerous. So things like urination and sex and movement are going to be perceived by the brain as dangerous. And so what would happen if you just said, yeah, I've got some pain and I've been checked out and there's nothing significant. There's no tumors, there's no fractures, there's no life-threatening illness there. All we've got is the doctor's best guess based on their assessments as to what's causing it. And here's the what if. You know, a lot of people say, what if the doctor is right? What if it's structural? But what if they're wrong? And it's just TMS manifesting itself in different parts of our body, in different types of pain or symptoms. What if the doctor's wrong? And as it relates to TMS, most often these doctors are wrong. They're constantly wrong. They're giving us incorrect diagnoses and definitely incorrect prognosis of what your future looks like, you know? If you've ever heard a doctor say, yeah, you're going to be in pain the rest of your life, or get used to it, or I don't know what's causing this, so, you know, get used to it. There is no cure for this. It can only be managed. To them, I say, fuck you. Right? Because they don't know about, or they don't understand, or they certainly don't accept this thing called TMS. Mind-body syndrome, stress illness. I call it distraction pain. Right? The mind and body, they're not connected. They're not. They're one system. Right? They're one system. So look, the medical labels will do nothing other than keep you in that medical paradigm, keep you scared, keep your brain convinced that there's something real and authoritative and scary going on. Because when you think about neuralgia, that's a problem with the nerves, and maybe it's being pinched, or maybe it's being, you know, impeded, or it's inflamed, or something. But what if it isn't? What if the doctor's wrong and you are not allowing yourself to recover with this TMS approach because you are so focused on the words that this guy in a white lab coat and fancy degree on the wall has told you? But yet he was completely unable to heal you or help you. If they're so smart, why don't their treatments work? If they're so smart, why don't their drugs solve the problem? If they're so smart, why are you still struggling? So, rule out the life-threatening. And then rule in this thing called TMS, or distraction pain, or stress illness. Lots of assessments that do it. But once you've ruled in this thing called TMS and you've read the books and you said, oh my God, that's me. That's me on those pages. Got to drop the medical labels, because all you're doing is confirming with the brain that there's something dangerous going on. There's something broken going on. And if you keep on using these medical labels to describe what's going on, don't be surprised when the brain says, that's significant, that's dangerous, that's a real problem, I'm not going to let go of the pain, because the brain believes it's dangerous. So, the medical labels don't help. And to that same topic, stop researching. Stop going to Dr. Google and asking him what you should do. Because inevitably, Dr. Google doesn't know about or teach TMS either. You know, Dr. Google, Wikipedia, WebMD. These places are not your friends. All they will do is cause further fear, further uncertainty. So again, I learned this from Dr. Schubner. Give him 100% credit. His suggestion is rule out the life-threatening, significant medical issues that require medical attention, infections, fractures, things like heart disease, cancers. Rule those things out. Once those have been ruled out, then you rule in TMS. And if you want to know about those assessments, go to the Pain For You group on Facebook. If you're not a member, join. But the very first pinned post, when you get to the group, the very first pinned post is, are you unsure if you have TMS? And there's several assessments there. Why are there more than one? To get a consensus. If you can get 3 opinions from the PPD Association, from my website and from a pain test, and all of them say, yeah, TMS is really indicated here, then you can relax and know that you're okay. It's just TMS. So please stop using the medical labels. You know, and sometimes I've caught myself, and you know, people will say, well, what was your problem? I said, well, I have back pain and sciatica. Now, when I'm aware of it, I will say, I had back pain and nerve pain down my leg from TMS. Or I will say nerve pain down my leg that doctors call sciatica, to kind of connect the dots a little bit. But none of it was really a problem with my nerve. It was TMS that manifested itself as nerve pain. So get rid of the medical labels. It's really important. You want to send the right message, a consistent message to your brain, that there is nothing dangerous, there is nothing harmful, there's nothing wrong with your body. It's just TMS. It's just mind-body syndrome. It's just distraction pain. It's just stress illness. You're not broken. So, love you guys and gals. We'll talk to you soon.